So we're at the lunch break on the second day of the fire camp, and I'm here with Grahame Grieve. If anyone who is listening to this doesn't know him, he is the founder of FHIR. And yeah, so just at a really high level, Grahame, why are events like fire camp important for the fire community?
Hey Kurt, nice to be here with you. From the start, one of the main focuses of building FHIR was building a community that's active, because the primary problem we have is a people problem. Getting people skilled up and enthusiastic and having the right connections so that when they have problems they don't know how to solve, they know who to ask. And so all the fire events that we have of all the different kinds are really valuable. This one's really good because developer focused, informal. It's a great learning and meeting environment. I'm thrilled to be here.
So yesterday, we were talking about the history of fire, and I noted on like a few of the experts on the round table, there was a note of nostalgia for the good old days where everyone was hacking late into the night. Do you think that there is a tension between kind of success of fire and the community getting large and kind of maintaining that enthusiasm?
It's not so much about maintaining enthusiasm, but the kind of things that you're enthusiastic for have to change as your project and process, and it's part of human organisation. And we've had to change our focus. And personally, I'm the kind of person who really enjoys the early phases of a project and find it really easy to lose interest once the going gets constrained,
right?
You know? And so, but I've had to say, no, we want to succeed here, and that means have to finish the journey off, and you can't just go, oh, I'll hand it over. People are expecting me to see it through. And so we're in the seeing it through phase now.
Yep.
And sure, we missed the phase back when it was risky and innovative and fun, but at the same time, we didn't know whether it was going to work, and now it's worked, and so we've got to take that, right?
Yep. And so, do you think that there is emerging like a standard tool set for implementers, or is it in the nature of fire for things to be diverse and never converge?
I think that we're seeing convergence around several different tool sets, different ecosystems, driven by differences in what people are trying to achieve, differences in their own corporate culture and the kind of tools they want, and also differences in the platforms provided by the large IT communities. And so you're seeing convergence in a number of different places. And I think it's very good that we're not converging on a single tool set or an architectural approach. From my point of view, we're doing interoperability here, which is exchange between different systems. And so I'm really glad that we have multiple different ways of, helping people solve their problems.
Right. I feel like there's been a little bit of a tipping in the opinion of application of AI in digital health, in interoperability. Would that be accurate, or do you think there's a role in AI for digital health?
There's certainly a role for AI. We don't yet know exactly what it is. One thing that AI is already good enough to be used in production in healthcare is in summarization and communication. To get a really technical document and produce a summary that's suitable for someone who's not technical. AI is already very good at that, and it's in production doing those things. When you come to things like diagnosis or checking diagnosis or monitoring process health or predicting outcomes, AI is good, but not quite good enough yet. And there's an active debate in the community about whether AI is going to mean that we need more or less data. I suspect, although it's only a suspicion, it's not even a strong opinion, that we're going to need more data, because the problem with healthcare is the tail is really long.
Yeah.
And it, people, the last 10% of cases are limitlessly complicated, and health needs to worry about the tail. And so we can't just say, we'll not worry about finishing the tail off, and it's really expensive. And I think it'll prove that we need good data to help the AIs grapple with the complexity in the tail.
I remember I think it was Dev Days in 2023, you were speaking about one of the main motivations for keeping FHIR free and open source was its application in developing low resource settings. Do you think that is still a primary concern with FHIR, and how do you think that is going in practice?
Still certainly a primary motivation, that we didn't want FHIR to only be useful in the developing world. Things have certainly been slower to develop than I hoped in lower middle income countries. In a lot of ways, it's simply that they don't have enough of a healthcare system to have maturity, to have digital interoperability in. But even that's true in parts of Australia, for instance, where, we're talking very low budget provision of services. And so it's still very important to me that we have very low, that we have free tooling, no encumbrances stopping people from adopting. And when I talk to African implementers, and I'm going to Africa next week, it is very important to them that they don't have to try and find money to get going. Yep. With the standard. And so I'm really pleased about how that's playing out.
Finally, what are you excited about for in FHIR for 2025?
Certainly excited about, bursting into life in Africa, and that really seems to be happening. I'm really looking forward to the process of finalising the next major release. It's going to be a bit of a grindstone affair, but it will be really good to get that done. And I'm really looking forward to seeing a lot of implementation work around IPS and patient empowerment, and sure that we'll just keep getting bigger and busier. And who knows what will happen, say, with the American regulatory process. But it never seems to me that there's any way but up like a rocket in digital health.
Grahame, thank you so much for your time.
Pleasure.